Hello. So at CRISIS, we usually start off meetings with a reflection. So I wanted to pick this one because it's one of hope. And I think with COVID, this is the time that we've had the most amount of hope. This is from John F. Kennedy. We're not here to curse the darkness, but to light a candle that will guide us through the darkness to a safe and sure place. And this vaccine is probably the most hope that we've had since COVID started. I'm going to focus on the COVID vaccine from Pfizer. The one from Moderna is very, very similar. So it's the same technology. So what's true for the Pfizer is also going to be true for the Moderna. One exception is when it's due to get the second vaccine, but we'll get to that a little bit later. So what the vaccine is it's a messenger that codes for the spike protein. The spike protein is what gives the corona the crown on the outside. It's in this diagram, it's the red proteins that are on the outside. So the vaccine sends a message to the cell that allows your cell to make the spike protein, and your body develops antibodies against the spike protein, and it protects you from getting COVID-19. It's an mRNA vaccine. This is a new, but it's not unknown. They first started working on mRNA vaccines in 1990s, so there are 3 decades of work that has gone into this. The mRNA vaccine does not contain a live virus. You cannot catch COVID from the vaccine. And the mRNA, the vaccine itself, does not interact with your own DNA. What the vaccine is a little droplet that has some fat on the outside. It has some fluid on the inside that carries the messenger RNA, carries the message. This goes into the cell. Through normal processes, your cell reads the message, makes the protein. The protein is then expressed, and your immune system detects the protein and mounts antibodies to it. The mRNA is quickly broken down through normal cellular processes. It was approved by the FDA for emergency use on December 12th, 2020. And it was used in England for several days before it was started in the United States. It's a series of 2 vaccines. The Pfizer is given 3 weeks apart. The Moderna is 4 weeks apart. For the Pfizer, there is a 4-day grace period. So instead of doing it on day 21, you can do it, if necessary, as early as day 17 from when you got the vaccine. If you go beyond 21 days, you should try and get it as soon as possible, as you can to the 21 days. But you do need both the first and the second dose in order to have the full protection that the vaccine can give. If you start with the Pfizer, it's important to finish with the Pfizer for the second dose to also be Pfizer. If you start with Moderna, it's good for the second dose to also be Moderna. There are no clinical trials where they started with one vaccine and finished with another one, so they're not really sure exactly if it's going to be as effective. So the recommendation is if you start with one to finish it. If inadvertently you get administered a different vaccine, the CDC at this time does not recommend starting over. So you can just stay with those 2. I'm sure they'll be tracking people who have where this occurs. The CDC also recommends when you get the COVID vaccine, not to get another vaccination either 14 days before or 14 days after. So if you're going to have the flu vaccine, if you get it, you should wait 2 weeks before you get the first COVID. Then if you didn't get the flu vaccine, but you want to get later on, if you get the first COVID vaccine, you have to wait 3 weeks after the first to get the second Pfizer COVID vaccine. Then wait another 2 weeks, and then you can get the flu vaccine or any other vaccine. If for some reason you do get another vaccine within 14 days, there's no need to repeat either vaccine. They're just trying to maximize your response to either of the vaccines. For people who have had COVID, they are recommending for people to get the vaccine. The reason is that COVID-19 is a new disease, and we're not really sure how long the antibodies are going to last. What we know with other coronaviruses, kind of like the common cold, is that the antibodies drop off after several months. And everybody's different. Some people, it may begin to drop after 3 to 5 months. Other people, it may be longer. Giving the vaccine and giving 2 vaccines, it triggers your immune system to put these antibodies into the memory of your immune system, so that if you get exposed to it again, your body's going to quickly respond. And it will also should keep you protected from COVID for a longer period of time. For people who currently have COVID, they're recommending to make sure that you recover fully from COVID before you take the second vaccine. There have been some people who were exposed, developed COVID after the first vaccine, and then we just say, just wait till you're done with the symptoms, and then you can receive the second one. For people who have received passive antibody therapy, so this is going to be people who receive the monoclonal antibody and also people who receive convalescent plasma, you would have to wait 90 days after receiving the antibodies before you can receive the vaccine. And that's if it's the first dose or the second dose, you still have to wait 90 days before you would get the vaccine. For people who've had exposures, they're recommending for you to wait until you're done with the quarantine period before you get the vaccine. The reason why they say this is to avoid exposing healthcare professionals that are giving the vaccine or other people that are getting the vaccine. At Cabrini, we've given over 2,000 vaccine. Some of our associates were exposed. They got the first dose and they came down with COVID. They didn't have any bad outcomes because of it. And once they recovered, they got the second dose. Right now, the recommendations are for healthcare workers, people who reside in congregate healthcare settings, such as nursing homes. And in Louisiana, it's also for patients who are in a home healthcare setting and who are over the age of 70. For people who have underlying medical conditions, the vaccine can be administered provided they don't have a contraindication. A little bit further on, we'll get into what the contraindications are. People who do have underlying medical conditions, they may be at a higher risk of developing a severe COVID disease. So it's going to be important for them to be vaccinated to protect them from COVID. In the safety trials that were done initially, it showed that people who did have underlying medical conditions had similar safety profile. So once again, the CDC does recommend to be getting the vaccine for people who have underlying medical condition. If a person is severely immunocompromised, such as HIV, they also are at an increased risk of having COVID. It would be good to work with your healthcare provider to maximize the immune response that when you get the vaccine. This would also be true for people who are immunocompromised, let's say to chemotherapy. So it'd be good to work with the oncologist on the timing of the COVID vaccine. For pregnant women, there is no safety data on the COVID vaccines in pregnant women. It is an mRNA vaccine, does not contain live virus. And as previously mentioned, the mRNA is quickly broken down by normal cellular processes and does not enter the nucleus of the cell. Although there are no current studies on pregnant women, they are doing animal studies, and it is presumed to be safe, which is why the CDC is not making, or the FDA, not making pregnancy a contraindication to getting the COVID vaccine. Another thing to consider is that women who are pregnant, they are at an increased risk of having a severe COVID disease, and they can also have adverse pregnancy outcomes such as preterm labor. So women who are pregnant are recommended by the CDC to get vaccinated, but you should discuss it with your healthcare provider. For women who are breastfeeding, once again, there is no data on women who are lactating and receive an mRNA vaccine. However, the breast milk does contain antibodies, which is a good thing. It protects the newborn from viruses that are floating around in the community. The mRNA vaccine, once again, is not a live virus, so you're not going to be able to transmit COVID through breast milk. And you would be giving antibodies to the newborn and protecting the newborn to some degree. As far as side effects, most of the people who get the vaccine on their shoulder, wherever they get it, on whichever shoulder they may have some muscle soreness. Many people also have fevers, and they could feel kind of like a little bit under the weather. And you can take Motrin or Tylenol for the fever. And we've given over 2,000 vaccines, and we really haven't seen any major reactions to it. As far as the efficacy, how well the vaccine works, after the second dose, you're like 95% protected. So if there are 100 people who get both vaccines, 95 of them will not come down with COVID. What we're seeing with these new strains that are popping up, such as the one from Britain, is it does offer some protection. It's not quite 95, but it does offer some protection. With the other strain, which is from South Africa and also in Brazil, we don't have any data on that. It is more important to try and get the vaccine out into the community to help prevent these strains from developing. And once again, it's important to get both doses in order to be protected. The public health recommends for people who get the vaccine to remember that no vaccine is 100% effective. So they recommend to still be wearing the mask, still be staying 6 feet away from others, doing the social distancing, avoiding crowds, and washing your hand. One thing to keep in mind is that the mask is actually helping for other diseases such as the flu. At Cabrini, since October, we have not had any positive flu tests. So all of the hand washing and wearing the mask is also helping for that. As far as contraindications, if a person had a severe allergic reaction, so this is going to be an anaphylactic reaction, it would be an example. These people tend to develop rashes, their skin can turn really red, they can develop hives, and they can have a lot of other organs which are affected. If a person has an allergic reaction, an anaphylactic reaction to the COVID vaccine, to the first one, it is recommended not to get the second. If a person has had reactions to other injected vaccine or other injected medications, you can proceed, but it should be with precautions. When a person is vaccinated, we monitor them for 15 minutes. If a person has a history of anaphylactic reaction, we wait for 30 minutes. I'm going to go back to the diagram of the vaccine itself going to the cell. The vaccine itself, what it contains is little fat droplets on the outside. And then the blue fluid is the carrier, and that contains polyethylene glycol. And they believe that is what's triggering the anaphylactic reaction. And the mRNA is not believed to be causing the anaphylactic reaction. mRNA is in every single cell. So they believe it is the polyethylene glycol. So if you do have an allergy to polyethylene glycol, that would be a reason to proceed with caution. As far as contraindications or precautions, if a person has an allergy to food, to pollen, to oral medications, to latex, those are not contraindications, nor are they precautions. So you can definitely be vaccinated if you have those types of allergies. The difference between an immediate allergic reaction, such as an anaphylactic reaction, most of these occur within 15 to 30 minutes. People feel like there's an impending doom. They feel like they're going to die. 90% of these are going to have skin symptoms. So once again, the skin can turn red, they can develop hives, their lips may swell. They can also get confused, disoriented, dizzy. They can have shortness of breath. Their blood pressure can drop and their heart rate can go fast. They can have vomiting, nausea. The important thing about this is getting treatment really fast with epinephrine. Other people can have what is called the vasovagal reaction. These are people who, when they get blood drawn or they get a needle stick, they can pass out. And what happens is they get dizzy, lightheaded, and they can pass out. That is not considered, an allergic reaction. That's just a nervous system response to getting the injection. And then the side effects, such as having fever and muscle aches, they usually occur from 1 to 3 days. I haven't known of any person, and once again, we've given it over to over 2,000 who's had these reactions last beyond 3 days. They can have fever, chills, fatigue, and headaches are going to be pretty common. So once again, if you've had a history of anaphylactic reaction to any injected medication or to another vaccine, when you get the vaccination, we would wait for 30 minutes. Other people, we would monitor them for 15 minutes. And once again, if you've had an anaphylactic reaction to the first COVID vaccine, then we would not recommend having the second vaccine. One of the things that's important if a person does have an anaphylactic reaction is to make sure they get treatment immediately, and that's with epinephrine, and then making sure that the emergency medical services are contacted. This is going to be a summary of how people what they have to worry about or who can proceed with the vaccine. If a person's they can proceed with the vaccination if they have just like allergies to oral medications, to food, or to things like pollen. In those cases, we can observe for 15 minutes. If they've had anaphylactic reactions to anything like an oral medication, then we would wait for 30 minutes. The ones that we would proceed with the vaccine that they can get it, but it should be with caution, is people who've had an allergic response to injectable medications and injected vaccine, or if they have an allergy to a component of the vaccine, such as polyethylene glycol or polysorbate. In those cases, we would want to observe the person for 30 minutes. The contraindication is in the red box, and that's if a person has had an allergic response, severe allergic response to the mRNA COVID vaccine. That's if they've had anaphylactic reactions, if they've had immediate allergic reactions of any severity to any previous mRNA vaccine. Then it would be, those are the people who we would say do not get the second vaccine. If you do have an adverse reaction, there is a vaccine adverse event reporting system, which is going to be on info@vaers.org. And another place is going to be VSafe, which is Vaccine Safe. You can type in vsafe.cdc.gov. There also is the QR code. You can register. You will be prompted with a text to answer questions. So after you get the vaccine, we highly recommend for people to be doing this so it can be tracked and we can make sure it's safe. This is other information where you can get VSafe. The COVID vaccine, it does make your body produce antibodies. So if at any point you get a test, an antibody test for COVID, those will be positive. And this is going to be because your immune system is doing exactly what we want your immune system to do, which is going to be to produce the antibodies. If you're worried, if you start having symptoms, and we said it's effective 95% of the times, but you may be one of the 5% that's not effective. If you have symptoms and you think you may have COVID, the COVID vaccine does not affect the results of either the PCR or the antigen test. So you would still be able to do other tests to find out if you have COVID. The antibody would be the one that would show that come up positive with the mRNA vaccine. Right now on the screen is just other resources that are available from the CDC on the COVID vaccine. And at the bottom of the screen, also from cdc.gov /vaccines /COVID-19 /index HTML is just more information on the vaccine. This is going to be for healthcare personnel and also residents of long-term care facilities. And the FDA also has additional information which is available. If you do want to get the vaccine at Cabrini, we've already given out the first doses, and the last time that we will be giving a second dose of the vaccine will be on February 20th of this year. People who want the vaccine can still get it through Christus Physician Group. You'd be able to sign up on christushealth.org. There's going to be a sign for the COVID information COVID vaccine. I clicked on it last night and it's up and running. It asks you a series of questions to make sure you qualify for the vaccine. You can put in your zip code and it'll let you know which ones are sites that are available, where they have appointments available. In Alexandria, they're also giving it out at the Coliseum through the Department of Public Health. They gave them out today. I believe it was about 400 vaccines from vaccines that we donated to the Office of Public Health. They're going to be giving vaccines again on Thursday. You do have to register for those. You can go to covidvaccine.la.gov. Once again, you will have to answer some questions to make sure you qualify, and then you'd be able to schedule the date and time that's convenient to you. So that's the end of the presentation. And if anyone has any questions, just let me know.
Dr. Sapatero, there are 3 questions in the question and answer box. If you want to open those and give them a look, or either I can read them to you, whichever.
All right, so the first question is, I had Guillain-Barré with a vaccine. Is it safe to receive COVID-19 vaccine? So the CDC, once again, did not place that as a contraindication to getting the vaccine. Guillain-Barré is caused by antibodies, and then it cross-reacts with other receptors in your body. There's no way that anyone can guarantee that it will not happen. The thing that I think is important to keep in mind is both the Pfizer and the Moderna, what it is the mRNA of the spike protein. And the antibodies that you develop are going to be to the spike protein. So let's suppose you have not had COVID, but you're out in the community, you don't get the vaccine. If at any point you get exposed to the vaccine, to the COVID, and you contract it, you are going to produce the antibodies to the COVID vaccine. So one of the things that we've seen is people who have had COVID, they will develop antibodies, and in some people, it cross-reacts with platelets, and their platelets get destroyed. And that's called ITP, idiopathic thrombocytopenia purpura. It definitely is possible that the same way that that the virus, you can develop antibodies to it, to the spike protein, it's possible it can happen with the vaccine. So it's possible, but just keep in mind that the vaccine is only coding for the spike protein. And if at any point you are exposed to the virus, it's going to produce the spike protein. It's going to do a lot more damage than just that. All right, the next question is, I have 2 healthcare worker friends who are very healthy, but they really had a bad day of severe flu-like symptoms after the second Moderna vaccine. This is very scary for those of us that are not as healthy and are older. Are there medications that should or should not be prepared in case you have a reaction? So what's happening in these cases is your immune system is doing exactly what we expect your immune system to do. When your body produces a spike protein, your immune system thinks that there's the virus and it mounts an immune response to it. That is going to cause you to develop fever, muscle aches. So the way that that you could protect, you can decrease these side effects is to be taking anti-inflammatory medications such as Tylenol or Motrin. It is, it can be a bit scary, and nobody likes feeling under the weather. The one thing about the vaccine is I haven't seen anyone who's had an adverse reaction for more than 3 days. But when people get COVID, they're going to be sicker for longer than 3 days. The next question is, if someone has asthma or diabetes, can they still get the vaccine? And the answer is yes. Particularly people who have diabetes can have a really severe COVID disease, and getting the vaccine would protect them. Another question is for asthma, and it's going to be the same thing, yes. And how do you get the vaccine? Once again, you can go to christushealth.org. There's going to be, it's going to say COVID vaccine or COVID information. You click on that, and it'll start asking you questions to see if you do qualify for the vaccine. And if you do, you plug in your zip code, and it'll tell you that's not just for Louisiana, it's also for all of the Christus ministries. So if you live in Texas, you can also be able to get it there. In Louisiana, you can also go to covidvaccine.la.gov. They will also be asking a series of questions to make sure you qualify, and then they'll tell you where it's available.
All right, looks like we got another question.
All right, next question is, my husband had a heart condition. Will he be able to get the vaccine? So once again, the CDC does not list any medical problem as a contraindication to getting the COVID vaccine. What we have seen in the patients who get COVID is if you do have heart disease, you can really have a very severe outcome. The COVID disease, it causes a lot of inflammation in the body, causes inflammation in the arteries, and people who have had COVID have had rise in cardiac protein showing damage to the heart. So it would be, so the vaccine would be protecting people who have heart disease from developing severe COVID. I think there were two questions that were emailed. Let me see if I can just find those. Shelley, I think you sent those to me. Let me just check.
Yes, hold on. I am pulling it up right now.
All right. All right. One of the questions is if they already had COVID and they have antibodies, should they get the should they get the COVID vaccine? They heard if you get the vaccine, it will destroy the antibodies that were made by having the virus. Is that true or not? If you get the COVID vaccine, it's not going to destroy the antibodies that you already have. What it's going to do is that it's going to strengthen the immune response and keep the antibodies active for a longer period of time. So the recommendations are for people who've had COVID to get the vaccine. Once again, this will protect you longer. Another question that was sent in was, after the first shot, if you had a serious reaction such as rapid heartbeat, should you get the second shot? This question is a little bit tough to answer, but it's a very important question. An anaphylactic reaction can cause the heart rate to go high, but 90% of the people who have an anaphylactic reaction have a skin reaction, whether it's that they turn red or develop hives. If it's heart rate alone, it could also be from going high. It could also be from the vasovagal response, where people's blood pressure just goes down, just part of your nervous system kicking in. In that case, it would not be a contraindication. I would recommend that you speak with your healthcare provider and to really get a little bit more information on this. If you did have a rapid heart rate, I would also encourage you to log on to vSafe to report that, to make sure that this can be tracked. All right, we have another question. If you are immunocompromised, should you get the antibody test to ensure that you did develop antibodies? Right now, it hasn't been recommended for that to be done. What I would do is work with your healthcare provider. I think it's more important to make sure that they optimize the timing of the vaccine. And getting the antibody, it can be done to see if you did mount an immune response to make sure you're protected. But I think it's important to try and optimize when you get the vaccine so you can get the best response. The next question is, how long after having COVID-19 do you have to wait? So if you had COVID-19 and you developed and you went to get the monoclonal antibodies, or you were in the hospital and got convalescent plasma, you need to wait 90 days. If you did not receive monoclonal antibody or convalescent plasma, you just have to wait to have fully resolved all of your symptoms. So once your symptoms are completely resolved, it's fine. You also want to wait at least 10 days from the onset of symptoms if you had mild to moderate disease. If you had to be hospitalized, you really want to wait a minimum of 20 days, and then you'd be able to get vaccinated. All right, the next question is, my husband has rheumatoid arthritis. Will the vaccine affect him? So this is, the vaccine is an mRNA vaccine. It is going to cause your body to produce antibodies to the spike protein. It can interact with different tissue, but that would be true for the vaccine or for COVID itself. People who have rheumatoid arthritis, a lot of times they are on immunosuppressant and they can have severe disease. So the FDA and the CDC did not make having rheumatoid arthritis a contraindication. So it would be, they would be saying, yes, he can definitely get it. Once again, if he is on immunosuppression, I would work with his primary care provider to try and optimize the response from the vaccine.
Dr. Sapatero, we had another question come in through email. This question, this attendee says she's 56 and she has high blood pressure. She's curious as to when vaccines will be available for her age group.
Unfortunately, we don't know. I know that the governor looked at the number of healthcare professionals in the state of Louisiana and has the population broken down by age and different risk factors. Right now, they're restricting it with age-wise greater than 70. And the concern is that there's so many people over 70 who have not received the vaccine yet that they really want to make sure that they get vaccinated. As the government rolls out, makes more of the vaccine available, hopefully we can speed this up, but I don't think anybody knows for sure exactly when that's going to happen.
Okay, well, I believe that we are finished. I believe all of the questions have been asked. So Dr. Zapatero, any parting words for everyone?
The one thing I just want to say is, when I was first asked if I wanted to take the vaccine, I said I didn't know. I wanted to learn more about it. And after doing a lot of research, I did feel really comfortable getting the vaccine. It is something that it's not just about protecting you, but it also is about protecting your family, your friends, the people that you care about. If you get the vaccine, it can prevent you from transmitting it, to elderly and people who have these comorbid conditions that put them at risk for really severe disease. We are seeing our ICUs that are filled with patients that have COVID on vents. So this is something that really has to be taken seriously. So I highly, I highly recommend people taking all of these factors into consideration and discussing it with your healthcare provider if you have any further questions.
Thank you, Dr. Zapatero, for your time tonight, and thank you to our attendees for joining us. Again, as Dr. Zapatero told you, you can find information about the COVID vaccine, scheduling, where to find a vaccine, if it's your age group, if you qualify. That's all at www.christushealth.org. Also, if you have any other questions that you can think of but couldn't think to ask them tonight, please feel free to email me at shelly.murphy@christushealth.org. I would be happy to pass those along to Dr. Zapatero and to get those answered for you. And we just want to thank everyone for joining.